want to thank today's event supporters. I don't know if you can see the whole screen behind me. I'm not on camera, so I can't see that, but these are our supporters. We have Bristol Myers Squibb. We have Mallinckrodt. We have Biogen, and we have Genentech. And virtually, let's give them a round of applause, all right? They did a great job in allowing us to be able to do this, and so we want to recognize them for what they are doing. So, Dr. Williams is a world-renowned multiple sclerosis expert. Dr. Mitzi Joy Williams is a board-certified neurologist, fellowship-trained multiple sclerosis specialist, author, international speaker, and researcher who is passionate about educating and empowering of people affected by multiple sclerosis. She's got a very long bio as well, but I want to hit on a key point that she is the proud recipient of the Multiple Sclerosis Society's Hope Award and the 2019 BlackDoctor.org Top Blacks in Healthcare Award. And so let's take it away and let's let Dr. Williams empower you with her information. Thank you.
All right. Thank you. Good morning, everyone. And thank you so much for that great presentation, Dr. Thrower. I actually always learn something every time I hear Dr. Thrower give a talk. So very glad to be here with you all today virtually and to talk about a subject that's near and dear to my heart, MS in underserved communities. And we're going to throw in a little bit of an update about COVID-19. Perfect. So when we think about the face of multiple sclerosis, traditionally the face of MS has been that of a young white woman. And if we think about the characteristics around the world, this is still the most common face that we see associated with multiple sclerosis, is people who are of Northern European descent. So this is a slide that's just showing a little bit about the prevalence, and if you've ever heard me talk about this subject, you probably have seen this slide. But it just talks a little bit about how prevalent MS is in a couple of different parts of the world. So if we look at to the right of the graph, we can see Europe, where we still see the highest prevalence of MS. So in the UK, you're talking 90 to 190 people per 100,000. Scandinavia has a really high prevalence of MS, and also the rest of Europe. When we look at North America, on the other side, we can see the US is about 30 to 150 per 100,000. Canada is actually a little bit higher than us. But when we look at, for instance, Africa, we don't have a lot of information about the prevalence of MS in Africa, which makes it a little bit more difficult to extrapolate or to kind of correlate how MS behaves in the African American population or in people of African descent. When we look at the United States, again, we saw that the prevalence was pretty similar to the rest of Europe, a little bit lower than Canada and certainly much lower than Scandinavia. But there was a recent study that was published last year that actually gave us some better numbers about the number of people living in the US with multiple sclerosis. So we know that nearly 1 million people in the US have MS, whereas prior to that, we were quoting this number of 400,000. So actually, it was over double what we thought, and certainly some people still feel like that's even still an underestimate of the number of people with MS living in the US. When we think about the face of MS in the US, the face is a little bit different. So because the US is such a melting pot and there's so many people of different cultural backgrounds here, we actually are seeing a face of MS that's much more common than we previously thought. Now, again, if we look at the total numbers of people with MS, the majority of people with MS are still of Northern European descent. However, when we look at more recent statistics in the past 10 years or so, it appears that the risk for MS is actually higher in African American people here in the US, particularly African American women are driving those increased numbers of risk. This is a slide that looks at the incidence of MS by ethnicity, and it's a great slide that was published in 2013, well, a study that was published in 2013. And if we look at the numbers here, we see the white population in dark blue, we see the Black population in green, we see the Hispanic population in kind of this light blue, and then in an even lighter blue, we see the Asian Pacific Islander population. And so what we see is that actually the numbers are highest for the incidence of MS in the Black population. So when we look at the total, which is the part over here to the left, we see that it's highest in the Black population. But when we break that down and look at women versus men, we see that the women or the females are really driving that increased number. We can see a big difference between the females, but when we look at the males or the men, we see a little bit of a difference where it's higher in the Black population, but not nearly as much as we see with the women. So we can see that the women are primarily driving that increased incidence of MS. So one of the biggest questions that we have is, how do we determine ethnicity? And so this is an issue. And I have this slide here because honestly, how do we know? So so certainly there are some people that have very characteristic features of different ethnicities. But in some cases, there are some where the only way that we know is that people self-identify. So if someone says they're Black or they say they're Hispanic, then that's what they are, and so there have been some recent cases, unfortunately, in the news where people have been pretending to be Black or Hispanic, Latina, and they are not, and they were white. And so it kind of underscores the fact that we need to look at this on a more scientific basis. When we think about race, race is really a social construct, but we really need to be looking at ethnicity more so on a genetic level. If you think about ethnicity, for instance, in the African American population, meaning African descendants of slaves here in the US, we know that the percentage of African genes are about 70 to 80%, and the percentage of European genes are roughly about 20%. So we need to find more precise ways to look at this to help understand. And then the other issue that we need to address, especially when we talk about our scientific studies, is we need to find a better way to address people who are of mixed race ethnicity. And so, we shouldn't have to make people check one box when they may have multiple boxes that need to be checked. Why is this so important? So, Dr. Williams, why are you always talking about this stuff? I think that it's really important because we need to look at the outcomes. And so when we look at outcomes, I have a ton of slides that talk about some of the differences that we see, not only in the African American, but also in the Hispanic Latinx community in terms of outcomes. And so we see worse disabilities in these populations. But I didn't include all of those because we have some other things we need to cover. But I did want to include this slide because I think that it underscores how important this is. So this is a slide that talks about mortality or death, and it breaks it down by race. And so these were a group of people who had MS listed as their primary cause of death. So we're not talking about folks who had COVID or other issues like that. And so when you look at this from 1999 to 2015, what you can see is that overall, this light blue line that kind of has the highest peak is people who are of European descent. So overall, the total numbers of people who died due to MS being their primary cause of death was highest in white people. However, when we look at younger ages, right? So when we look at we see this curve separating after age 15 up to age about 40, 45, we can see that the line is higher in Black people. Okay, and so this is important because we need to try to understand how MS occurs and how MS, the disease course is different in these populations, because ultimately we want everyone to live well with MS, and we certainly want to decrease this number of mortality or this percentage of mortality at younger ages in the Black population. So how do we know, or what are some of the things that help inform outcomes, right? So when we talk about who has more disability, who may not have access to care, social determinants of health play a large part in making underserved populations underserved. And when I say underserved, that's not only ethnic minority populations, it could be people who are of lower socioeconomic status, also could be people who live in rural populations. And so social determinants of health play a large part in what we see in terms of health outcomes. So what are those things? Those are things like access to educational, economic, and job opportunities, right, which helps determine our socioeconomic status. Also, access to healthcare services. If you live in a rural community where you may not have access to MS care as readily, or you may have issues with transportation, or you may live far away from a medical center, it will affect how often you may access the healthcare system and how long you may or may not wait until you go see a doctor, right? Also, transportation, right? So for folks who don't have cars, I live in Atlanta, and in Atlanta, it's very hard to get around if you don't have a car. Unfortunately, our transit system is not as advanced as some of our friends who are in like New York and Chicago, et cetera, and also some of our friends who are over across the pond in Europe. So if you don't have access to transportation, you can't get to the doctor, right? And then also things like social support. You know, social support is extremely important, especially with a chronic disease like MS, because friends and care partners and family members can help remind you to take your medicines, can go with you to doctor's visits to help you retain some of the information. And then also things like language and literacy. So especially if you're talking about someone who may be an immigrant, it may be difficult to understand if things are not translated into your language. I'm very fortunate where I work in a hospital where we have a language line, but even that sometimes can be a barrier, talking on the phone and passing it back and forth, and things get lost in translation, so to speak. And then also access to media and emerging technology. This is extremely important, especially during this time of COVID-19, because many of the visits that are being conducted by neurologists, MS centers, primary care doctors are virtual visits. And so it's important, especially if we're trying to do a video visit, that you have access to internet, that you have access to a smartphone or a laptop. And so some of these things can really be barriers to care, especially during this time where we're very dependent on technology because we're trying to decrease the risk of people contracting COVID-19. This was a great study that was done in 2008 that looked at the access and utilization of neurologists by people with MS. And so this was really important because now we're not talking necessarily about an MS specialist, but we're talking about an access to at least a neurologist. Because if someone had a neurologist, they were more likely to be on a disease modifying therapy or at least be told about their options for therapy. They were more likely to be treated for different symptoms of their MS and to have some type of treatment plan in place. So this study just looked at those with MS who had access to a neurologist. And if we look at this list, the folks who were less likely to have access to a neurologist to treat their MS were those who did not have health insurance, okay, those who are lower socioeconomic status, and then we see African American on this list, unfortunately, those living in rural areas, and those who had MS for a long period of time who may have had progressive disease. And so these are very important underserved populations that absolutely need access to care. Next slide. And when we talk about racial disparities, okay, so this is disparities in access to neurologic care by all people with neurologic conditions. So this study was not specific to multiple sclerosis. But again, looking at particularly the African American population, there still are significant disparities in access to care. So they were 30% less likely to see a neurologist, more likely to go to the ER, to have inpatient hospital stays, and to have higher hospital expenses. So this was in 2017. So we can see that even from 2008 to 2017, there still are disparities, significant disparities in access to care for certain groups. And what about other underserved groups? So underserved groups, as I said a little bit earlier, is not just ethnic minority groups, right? So certainly with MS, people who are over the age of 55 are definitely an underserved group in terms of our access to research studies. Many of our studies stop at age 55. And so we know that there are many people with MS who are living well beyond the age of 55, and we want to know how medications affect them, how our treatments affect them, and that's a group that we don't have as much information about. We also need more information about people with comorbidities. When we look at a lot of our research, we have folks who have extremely well-controlled conditions. Their diabetes is perfect, their hypertension is perfect, or they don't have it. But when we get out in the real world, people have these issues and they're still trying to get them under control. So how do our treatments and all of our therapies affect these populations? And the honest answer is we're trying to find out, but there's a lot that we don't know. Also, another group is people who have an EDSS or disability score over 6. This is another group that's often overlooked in many of our research studies when we're trying to look for certain outcomes. So again, we need to understand, how the effects, how to most effectively treat this population as well. Certainly rural populations, as we discussed earlier, due to access to care, and low socioeconomic status groups as well. So again, when we talk about underserved, certainly it is not limited to just ethnic minority groups. So what about clinical trials? So I touched on this a little bit. When we look at our clinical trials, we don't have a lot of variety. We don't have a lot of diversity in our clinical research. When you look, particularly starting with like ethnic minority groups, there are less than 10% enrollment in almost all of our clinical trials. If you look at African Americans, there's probably about a 2% to maybe a 5% enrollment in most of our trials. Most trials bordering on like 2%. So we're talking maybe 10, 20 people out of several thousand. And then when you look at Hispanic Latinx communities, more like 5 to 8%, but still very small numbers. And then of course, we talked about some of our exclusion criteria with our trials automatically exclude people who are over the age of 55. Some of our newer trials are going up to 65, but many of our pivotal trials just went up to age 55. Certainly people who have those disability scores over 6 are often excluded, as well as pediatric populations, which I didn't address, also get excluded. And then, of course, when we talk about low socioeconomic status, they're not automatically excluded, but certainly there could be issues with access to care and transportation as well for these groups. This was a study that I was fortunate to be second author on back in 2015, where we looked at MS in several minority populations. We particularly looked at African Americans and Hispanic Latinx communities, because those are the two largest minority populations here in the US. And what we found was that out of all of the studies that had been done at that time, all the studies that had been published in English, which was over 50,000 studies that have been published in English about multiple sclerosis. There were approximately 113 studies about African Americans, and there were less than 50 studies about Hispanic Latinx communities. So these numbers have increased over the past 5 years or so, but they still make up less than 5% of all of the literature that we have about MS in these groups. And again, this is important because in order to understand the outcomes that we see, right, when we see worse disease and when we see more progression of disease, we need to understand what's going on within these communities. So again, why is this important? So minorities are underrepresented in clinical trials, but again, many of those other groups are also underrepresented, right? So this could apply to everyone. So we're missing different physiologic differences. We may be missing cultural or environmental differences that may affect the outcomes. And when we don't have diversity of age, of ethnic background, then it makes it more difficult to generalize our findings, right? Even when we don't have diversity within people who have comorbidities, we're left to kind of find out how treatments may act in the real world versus in our very controlled research settings. And that's also why it's very important for us to also look at what we call real world data. So certainly clinical trials are very important, but it's also becoming extremely more important for us to look at information from registries and other types of research so that we can understand how things react in the real world and not focus solely on what happens in our research studies. So this is a survey of 2,600 people with MS through a group called the Minority MS Research Partnership Network, where we did a survey asking people about research, because certainly in this time there's a lot of skepticism about science in some circles. And so we just asked people, what do you feel about research? What do you think? And we asked a series of multiple choice questions as well as kind of open-ended questions. And overall, the results of the survey were very positive. So most people had a positive outlook about research. And these were some of the words that people used to express their thoughts about research. So finding a cure, helping people get better, finding the causes of of disease, and this was specific to MS, trying, progression, thinking, and testing. And so there were a lot of positive responses. And so some of the most common reasons that people weren't involved in research is that they didn't know where to find out about studies and their doctors hadn't asked them. So there's a lot of work that we also need to do in the scientific community to make sure that we're trying to reach as many people as possible to be involved in the research process. So what does inclusive research look like? So inclusive research can look like a couple of different things. So number one, things that we can do in the scientific community are look at extending the age of certain studies to make sure that we're including more people who are living well and living with MS into older ages. I won't say old because the older I get, the older old seems to me, but I won't say old, but extending our ages, right? We know that 55 is certainly not the cutoff for people with MS, and we need to understand treatment algorithms in this group. And then when we think about the inclusion and exclusion criteria, right? Who can be in a study and who's automatically excluded? We need to look at things like the comorbidities, diabetes, high blood pressure, to make sure that we're including as many people as possible, but also keeping the integrity of the study. We also need to look at expanding research sites, right? In some cases, there are large academic centers that do a great job of recruiting for research, but sometimes there are smaller centers where you may have access to different types of groups of people that we may need to extend to do our research. We need to reach out to those researchers as well. And then also making sure that we're improving awareness and education about trials, and not just trials, but other research studies, right? So clinical trials are not the only type of research that people can be involved in. There are all kinds of amazing studies. There is work looking at exercise in MS. There are studies looking at diet in MS. There are studies that are registries where you can offer information about your attitudes about research or about your treatment course. And we, of course, need to increase the diversity, as I said. So making sure that we're aware of what's going on and recognizing that clinical trials are not the only way that people can get involved in the research process. So I always like to say, get in where you fit in, right? But there's some way that everyone can be involved. And I just wanted to take a few seconds to focus on a couple of initiatives that are really focused on trying to increase diversity about research. One of them, as I said, is the MS Minority Research Partnership Engagement Network. And so groups that are looking at ways to improve awareness, not only for the patient community, but also for the scientific community about the importance of reaching out to different groups of people to invite them to be a part of studies and not assuming that they don't want to be a part. And so some of the groups that we've been focused on are the African American community, the Hispanic Latinx community, and now more recently looking at the Native American community, which is definitely an underserved community in terms of multiple sclerosis, as well as the Asian population. This is a study that I wanted to bring attention to. This is the first minority-focused MS clinical trial called the Chime Study, and it is looking at the safety of one of our already approved medications for both African American and Hispanic American patients with relapsing multiple sclerosis. And the goal is to, again, in a controlled setting, try to understand how MS behaves in this group. Okay, everyone will be on treatment and have access to treatment, but also to maybe understand some of those biologic markers that we've been looking at in the broader population and see if we can understand how these may correlate or connect with outcomes in these particular groups. Other initiatives that are looking to address underserved populations are the MS in the 21st Century group, which I'm very proud to be a part of, which is a group that is focused on patient and healthcare provider communication and education. So being empowered to know what to ask or making sure that your issues are addressed when you go to the doctor is extremely important. And there are certain tools that this group has created through an amazing scientific process. And it's really a great partnership, which is basically half of the people on the committee are people who are living with MS and who are amazing advocates from all over the world, from the UK, from Romania, from Russia, and then also the other half is healthcare providers and other people who are part of the healthcare system to try to see how we can come together to address some of these issues. And one of the biggest things that we found is that there's often a disconnect. So we had a survey where we talked about progressive disease and how people have conversations about progressive disease. And one of the biggest things we found is that there was a big disconnect between what doctors thought that they were telling patients and what patients were actually receiving, as well as what doctors felt like people living with MS were able to receive, as well as what people with MS wanted to hear about in terms of progression. So I think there's a lot of work that we have to do in bridging that gap, and this is a group that does a great job with that. And then also I Conquer MS is an amazing initiative that is a patient-driven research organization, because again, as healthcare professionals, we think that there are certain questions that are the burning questions that just have to be answered with MS, but they may not be the questions that people living with MS want to know the answers to at least, all the time. And so it's important, again, to have that collaboration and that partnership so that we are not just doing the research that we want to do, but also answering some of the questions that people who are living every day with MS want to know the answers to. And then this is kind of my baby project that finally has come to fruition. Myself and many of my colleagues have been at hard work trying to start a registry for African Americans with MS for many years, and it's finally come to fruition. And the National African American with Multiple Sclerosis Registry just came online a couple of weeks ago, and we're extremely excited about it. So this is a informational registry to, again, help understand some of the risk factors for MS in the Black population, as well as some of the treatment, some of the issues like access to treatment, access to care, as well as the patterns of treatment in this population. So I'm extremely excited. The website is down there at the bottom in the browser. It does not work with Internet Explorer, but works with most other browsers. But again, this is a great initiative where we're really trying to address and help understand MS in some of these populations. So I'm super, super excited about this. All right, so let's switch gears and let's talk a little bit about COVID. And I don't know how much time I have left, but I'm sure Stu will cut me off when it's my time. Okay, so let's talk a little bit about COVID. So there were some great updates about COVID-19 at our most recent ECTRIMS ACTRIMS conference, which is usually in Europe, although I would have loved to have been in Europe. I got to watch it here on my TV, on my computer at home, so I still was able to get the updates and get the information. I always put a disclaimer up when I talk about COVID-19 because honestly, the information is changing so rapidly that what I tell you today could, have new information that debunks that information next week. So again, this is the information that we know currently, but this is subject to change because it's really a revelation in progress. We're really learning about this virus at a very rapid pace. And I've really been impressed by how the MS community globally has come together to try to understand MS and understand COVID-19 in the MS population. So there have been some really impressive collaborations, and we'll talk a little bit about those research updates over the next few minutes. So who can be infected with COVID-19? I'm not going to go through a whole thing about what COVID-19 is. It's a virus that can primarily cause respiratory issues. Some of the primary symptoms are people have loss of smell. People can also have a very high fever. One of the things that we're very concerned about as we go into flu season is that some of the symptoms can mimic the flu. And so it can be very contagious. And unfortunately, over 200,000 people in the US have died of COVID-19. So it's a very, very serious condition. And the answer to who can be infected is anybody. And so one of the difficulties with kind of getting control of the virus is that there are people who can be infected but be asymptomatic carriers. And also there can be a period of time before someone develops symptoms where they could be infected and walking around and infecting other people. And the reason that I really like this graphic is because it illustrates essentially what has been happening. So we got healthy folks walking around. We have some folks who may have had the virus and may be immune. We're still finding out a lot about immunity because we don't know a lot about if people can get it again after they've had it. And then there are people who can be infected. And again, they can be walking around just fine and could be infecting some of the healthy folks without even knowing it. So what do we know about COVID-19 and MS? So this is just kind of a quick update of much of the information that we learned at our recent meeting, which was a great collaboration of many of our colleagues from around the world, including the UK, Sweden, as well as the US. So what we have learned so far is that there are factors that can be related. Actually, can we go to that next slide and then we'll come back to this one? So there are a couple of different registries that presented information in the US, in the UK, as well as a new initiative called the Global Data Sharing Initiative. So the UK MS registry presented some data that suggested that when they went into lockdown, so they went into a lockdown very early in their country once the pandemic became underway. And what they found was that when people were under very strict conditions, wearing masks, social distancing, staying home when they didn't have to, there really weren't any factors that caused people with MS to do differently than the general population. And so they found that the same factors such as older age and comorbidities were the main things that led to worse outcomes. But this was people being under very strict conditions, staying at home, and not interacting unless they have to. And many of my colleagues there are still seeing majority of their patients via telemedicine. And so they're only seeing a small number of patients in the clinic to decrease people's exposure. So there's still a lot of restriction in terms of activity there. So that was reassuring news from the UK registry. When we looked at the COVID MS registry, which was the MS registry here in the US, there were close to about 600 or 700 patients, I believe, who they had information on. What they found was very interesting was that Black patients tended to have worse outcomes. And so that was something that was unfortunate, but something that we've seen in the general population at large, that there was more hospitalization, that there was more ICU admission. Fortunately, there was not a higher mortality rate in the Black population from the COVID MS registry, but certainly it was very concerning that the African American population tended to fare a little bit worse. And then finally, the Global Data Sharing Initiative is a collaboration of centers from MS centers from all around the world. They had about 1,500 patients that they presented on. And one of the biggest findings from their registry was that actually patients who took certain types of medications, basically our B cell therapy, so our anti-CD20 therapies, which include Rituxan or rituximab and also ocrelizumab, they found that patients tended to have a little bit of a worse outcome if they were on those medications. Now, these were not patients who were necessarily under any strict precautions or things of that nature, and they found that Rituxan had a bit more of an effect, a more dramatic effect on outcomes than ocrelizumab, but there was a trend toward ocrelizumab having worse outcomes as well. So that was some surprising data and very interesting data that we saw from ECTRIMS. And if we could go back to that last slide, that kind of summarizes some of the findings. So overall, factors that are associated with poor outcomes from COVID-19 infection in people with MS that were found, and there were several other registries that presented, including the Swedish registry and the French registry. What they found was that older age, so age over 55, which again is not old, okay? Age over 60, which again is not old, but older age tended to be correlated with worse outcomes, which is what we see in the general population. Something else that they found was people who had more progressive disease and higher levels of disability tended to have poorer outcomes in terms of COVID-19 infection. Also, something that was a little bit surprising was patients who were untreated and not on disease-modifying therapy tended to have more hospital admissions and also have more ICU admissions. Also, Black patients, as I discussed from the COVID MS registry, and those on anti-CD20 therapies, again, rituximab having more of a significant effect than ocrelizumab. And those are some of the significant findings. So again, we are learning more and more. Remember, it's always important to talk to your doctor about any changes that need to be made in your medications, etc., if those need to be changed. And then also, please try to make sure that you're taking precautions in terms of wearing a mask, social distancing, and not going to large rock concerts. Next slide. Next two slides. Perfect. Social distancing. So again, just my little note on social distancing. This is the goal, right? So if we see the infection kind of spreading among people, when we social distance, we can hopefully stop this chain of infection rates, which are leading to poor outcomes in some folks. And so, what can you do to prevent COVID-19 infection? Certainly, washing your hands, right? These are things that you've heard over and over again. But I think that as people are getting fatigued with staying in the house, sometimes we get a little bit complacent. So let's make sure that we're washing our hands, that we're trying to practice social distancing, that we are avoiding touching our face and eyes and nose unless our hands are clean. Certainly, we don't want to cough or sneeze on anyone. And then, of course, especially with MS, work decisions need to be made on a case-by-case basis with your healthcare provider. Different sources of information that are great, right? That keep up to date about COVID-19 and are also doing great programs and webinars about the subject are the CDC, certainly the WHO, the Consortium of MS Centers has some great programming, the MS Association, of course. MS Views and News is always on top of it, and we're one of the first, I think maybe the first group to do a webinar about COVID-19 and MS. And then another great resource is the Multiple Sclerosis Academy, which is a UK resource that's online that has many different webinars that answer many of the questions that people want to know about MS in general, but also about COVID-19 if people need to review that. And so the last couple of things, how can you help us better understand COVID-19? So there is a COVID-19 survey that is sponsored through iConquer MS. There's also an autoimmune COVID-19 registry. And then for healthcare providers, there's the COVID MS registry, as well as the MS Data Alliance. And so helping us understand these cases and understand the trends of COVID-19 in the MS population is very important. And so again, I've been extremely impressed with my colleagues from all around the world who have really collaborated to try to make sure that we are getting the best information to people with MS as possible. And so the last kind of thought that I like to leave you with is hope, right? So even though there are many disparities and there are many underserved populations, there are many of us within the MS community that are really focusing and turning our attention to try to make sure that we're addressing some of these issues. And there are many collaboratives that are started by people with MS, just like you, just like Stuart, and MS Views and News, that are really trying to focus on the issues that are important and really trying to capture the best information to serve many of these populations that have been underserved and overlooked within the MS community. And my last two slides are stay connected. So I am the nerdy neurologist. You can't see my shirt, but it says nerdy neurologist here. But I'm the nerdy neurologist. I love to provide information about MS, and I'm very grateful to be a part of the MS Views and News family and work with Stuart very closely, but also have a YouTube channel and things like that. So this is where you can find me online. And then finally, we'll go to my last slide before we open up for questions. All I need is peace, love, and a freaking cure for multiple sclerosis. That's how I end every presentation because it is true and I mean it from the bottom of my heart. Thank you for your time and your attention. And I will have Stuart come back up and we will go through some of these questions.
Hi, thank you very much, Dr. Williams. That was great. Okay. I can't wait to listen to these things again because, unfortunately, with taking care of all the direction of everything going on, it's hard for me to pay attention to everything that's being said. So, again, let's give Dr. Williams a virtual round of applause. Yay! Thank you, everybody. Awesome. Okay, so we are getting ready to go into Q&A again, but a lot of people have signed on since I first opened up the program, and so I just want to let people know that I am Stuart Schlossman. You get plenty of emails from me. Yes, I'm president and founder of MS Views and News, and today we again have Jennifer online doing the questions that we received when people were first registering. She will be doing 2 questions at a time, okay? And we have Jill at the studio, and Jill will be handling all the online questions. So for those that don't know how to do or how to ask questions to Dr. Williams, on the right side of your screen at the control panel, there should be a thing there for questions, and you could click on it and then type in your questions, okay? And then we'll see them from here, and we'll be able to ask Dr. Williams these questions as well. So we only have 20 minutes to do the Q&A. Dr. Williams is going to be as quick as she can so we can try to get through all the questions, and I don't want to take up any more time. Let's get started with her questions. Thank you.
Hi, Jennifer. I wish we were all in person. I miss you guys.
We were together last year for this, I think. Miss
I
you, but this is
know.
great. Thank you so much. And I just tagged you on
Absolutely.
Instagram for the National African American with MS Registry. That's amazing.
Awesome.
Yeah.
Thank you.
So thank you. And these questions came in advance over the weeks prior to this, so I'm going to just jump right into it. Are there any
Okay.
studies that you know on progression in Hispanic males and what drugs are known to help?
So the short answer, unfortunately, is no. Again, the Chime study is one that we're looking at, particularly the African American and Hispanic Latinx community. So hopefully we'll have enough men in that study to get some information. But unfortunately, I do not know of any studies that are particularly focused on those issues.
Okay, all right, great, thank you. And I know you had a slide on this. Somebody's asking, are African Americans more likely to have rapid progression in MS?
So yes, there is more, there's an increased risk of progression, and there is an increased risk of higher disability, particularly with walking disability. So there are studies that suggest that people have an EDSS of 6, meaning they need a cane or a walker to walk, up to 6 to 10 years earlier in the Black population than in the white population here in the US.
Okay, all right, thank you. Thank you for that answer. I'm going to throw it over to Jill because she's got the live questions coming in.
Okay, coming in live. Did I do that? Yes, I'm unmuted. Hi. Okay, are there any numbers for people that also have Cooley's anemia?
You know, I honestly can't say that I've seen any data with the association of anemia with multiple sclerosis. I know that a large number of patients do deal with anemia, especially women, but I've not seen any studies with the association or any numbers concerning that condition.
Okay, well, thank you. Is there some approximate number of people with MS who have died from COVID or been diagnosed with COVID? I guess I should have asked in the other order.
Yeah, a great question. I do not know if there are any numbers associated globally. I know that the Global Data Sharing Initiative had about 1,500 patients in it with COVID-19 and MS. The COVID MS registry has about 599. I know that the Italian registry has 700 or 800. The UK registry also has about 500 or 600. So they're pretty significant numbers of people around the world with MS and COVID-19, but I don't know that anyone has added all of the numbers together as far as we know. But there's certainly
Okay.
several thousand, and I do
Thank
not
you.
know about the numbers of deaths.
That's great. Thank you. Jennifer, back to you.
Okay, thanks. Okay, so this is, I think, elaborating a little bit on your presentation. It says at one time it was thought that MS affected more Caucasians than other minorities. Now the number of minorities with MS is continuing to increase. Do you think that there's an environmental or societal factor that are causing these increases?
Okay, so I will try to be brief, but I could give a whole lecture about this one, okay?
Right.
So the honest answer is we don't know, right? Because of a variety of factors. So we think about access to care. Certainly some African Americans may not have been diagnosed because MRIs were not as accessible even 10 years ago as they are now. We also think about suspicion of risk. So if we think that most physicians, even myself, were taught that MS occurred in white populations, if we saw an African American with symptoms, MS certainly was not at the top of the list, which may have delayed diagnosis in some folks. So societal factors, absolutely, right, within the medical system. Environmental, we don't yet know. So we're still learning about things like MS in the gut, the foods that we eat, how those may affect our immunity. And so there's a lot of work that we have to do, but the honest answer is we don't know. We're trying to get to the bottom of it now.
Okay, but the work is happening, you're saying.
The work is happening.
Yes.
So the registry, and then many other initiatives are trying to understand why we're seeing these increased risk numbers.
Okay, great. And you talked about comorbidities. This person is asking, are people of color living with comorbidities at greater risk for a more aggressive form of MS?
So there's not really so yes and no, right? So there are studies that suggest independently, right, that things like obesity can affect the course of disease, smoking can affect the course of disease and cause progression, and then of course if you have other conditions such as diabetes, hypertension that are poorly controlled. You could have a heart attack, you could have a stroke, which could also increase your disability, as well as MS. So there have been things that show that independently comorbidities affect MS and that ethnicity affects MS, but we don't really have studies that link the two together and say that if you are African American and you have comorbidities, it will make you have worse MS. But you could sort of say that just looking at both independent factors affecting more aggressive disease.
Thank you for the answer.
Did that make sense? Did that make
Yeah,
sense?
it
Did I
does.
answer it? Okay, okay. I just wanted to make sure it makes sense.
Yes, it does. Okay, Jill, anything coming in?
Okay, I see a question that says, is there some approximate number of people who have died from COVID or been diagnosed with coronavirus?
So again, in the U.S., approximate number of people in the U.S. in general. So there are millions of people who have been diagnosed with coronavirus in the U.S., including myself. I had a bout with coronavirus and fortunately am able to tell the story. In terms of MS, again, the COVID MS Registry, which doesn't capture everybody in the whole U.S., but we know of at least 600 or 700 people in the U.S. who have had COVID-19 and MS, and I believe there were about 50 deaths so far in that registry, but I'll have to double check those numbers.
Great, thank you. And would you keep your patients on Ocrevus at this time with COVID if the patient is over 65 years old?
So that's a great question. It certainly would depend on the patient, right? So, we can't give particular medical advice, but it would depend on the patient if they had other comorbidities or risk factors or other issues going on. Currently, for my patients who are very stable on their therapy, I'm not changing their therapy. Unfortunately, the pandemic is going to be around for a while. So if this were something that we're going to go away in 6 months and we could just delay therapy, which we thought at first, then that would be one thing, but we're likely going to be dealing with COVID-19 at least for the next year or even longer after that. So we're just taking precautions and treating people as appropriately as possible. So I'm not automatically taking people off of their therapy if they're doing well.
Great, thank you. Jennifer, your turn.
Thanks, Jill. Any information on large populations of Filipinos living with MS?
Absolutely no information, actually. So I don't know of very much information about the Filipino group. Again, there are many of us that are trying to expand the ethnic minority groups that we look at and making sure that we don't make minorities a minority and just focus on Black and Hispanic Latinx communities. But I've not really seen very much research about the Filipino community, unfortunately.
Okay,
That's certainly
thank you.
something I'll take back to groups.
Okay, and are there any Black, Latino, or LGBTQ specific support groups that you know of for MS?
So certainly there are some in Atlanta. There are some Black support groups here in Atlanta. I would encourage everyone to hook up with their local societies that often have a list of support groups in their area. So MS Society, MSAA, can be resources to find support groups in your area. And then of course, what's the word I want to say? Charge to those. If it's not there, then maybe you're the person to start it. So there's always room for people to address these interests. So maybe that's something that someone out there is ready to start.
So true. Thank you.
Mm-hmm.
Okay, Dr. Williams, are there any group studies around Asian populations? Asian Americans, Southeast Asians?
So there are some, but the data is very, very little. So what we do know about the Asian population mostly comes from the Japanese population who have a form of MS that's called optical spinal MS. It actually is kind of nicknamed Asian MS. And so that's also the type of MS that we see in the Black population, where the optic nerves and the spinal cord are very much involved in a lot of the disability that we see. And so most of the information comes from the Japanese population, but there has not been a lot studied here in the US in Southeast Asian and Asian American populations.
Great, thank you. Jennifer, I'm sending it back to you.
Okay. Oh, here's a good one. It's a common question. Should I get the flu vaccine if I'm a person living with MS? And also, can I get the COVID-19 vaccine once it comes out if I'm a person living with MS?
So flu vaccine, yes, that's the short answer. COVID-19 vaccine, well, we don't have one yet. So, certainly there will be a lot of questions around the vaccine. It is currently recommended that patients who have MS do get, can have any kind of inactivated vaccine that's needed, whether it's the flu or whether it's other issues. If it is a live vaccine, it will be something you need to talk to your doctor about. But certainly if the benefit outweighs the risk, then we do have patients who do get live vaccines.
Okay, thank you. And this person's asking your advice, Dr. Mitzi. What's the best way to respond to someone that asks, why are you limping? I walk without a cane and I cannot see myself walking. I feel normal. But I guess from the outside, they're seeing them limping and they're asking them, I guess, how to respond to that.
Well, that's kind of rude. I mean, I think that you can be as open and as honest as you want to be, right? So you could say none of your business, or it may be an opportunity to educate someone about multiple sclerosis, right? And to be an ambassador and an advocate. You never know who else is connected to someone with MS. It's kind of like when you get a new car, right? You never saw it on the road, but as soon as you get a new car, you see it everywhere. And so a lot of people, when they get diagnosed, say, I didn't know anybody with MS before I got diagnosed, and now I know 10 people. I didn't know my neighbor had it, my friend's wife had it. And so it may be an opportunity for you to be an inspiration to somebody. And if you were to tell them about your diagnosis, but certainly it is yours to disclose whether or not you want to talk about it.
Thank you. Thank you for that.
Mhm.
Okay, back to me. I have a question here. If the Black and Brown communities do not participate in clinical drug or vaccine trials, how can we know for sure if those medications will be as effective as they might be in other communities?
The answer is we won't, right? Which is why it's so important for us to have diversity. And again, everybody has to make their own decision, right? I can't, clinical trials and research do have risks, right? And we don't underplay that by any stretch of the imagination. But certainly after reviewing the information, there are opportunities for everybody to get involved. So I do encourage my patients to get involved in research because that is the only way that we'll know.
Is there a particular way that people could be encouraged?
So there are different initiatives that are looking to educate about research. So I think one of the things that people need to understand the research process, especially for the Black community, there's been a large, long history of discrimination within the healthcare system and unfair experimentation. So I think that a lot of it is on us as healthcare providers and as patients and for people living with MS to educate themselves about the process, right? There are many safeguards in place to make sure that research is done ethically. And then also ask your doctor about it, right? There are also other sites, such as I believe there's a site on the MS Society as well as clinicaltrials.gov where they talk about different research projects that are going on. But you can always go to your doctor and ask them about what research is going on in your area.
Great, thank you. I have one more question here. What is the latest information on blood type and the prognosis for COVID-19, and does it apply to MS patients as well?
So there has not been a lot of, I really haven't seen any specific research to blood type in MS and COVID. In terms of COVID in general, there were some studies that suggested that people with type O blood may have a better prognosis. I'm type O, and I had a rough course, but I wasn't hospitalized, but it was pretty rough. So so far we've seen type O associated potentially with better outcomes.
But it didn't hold true for you.
No, I had a rough time.
Okay. Jennifer, back to you.
I'm looking at what can we share about COVID-19 and its impacts on the Black community. Are we as MS patients more vulnerable to the coronavirus than anyone else?
Great questions, which I will try to answer briefly. So there's been a lot of data. So COVID-19 has really brought a lot of attention to health disparities that have been present in the US forever. And one of them has been this focus on minority communities and the increased rates of infection, the increased rate of death, which are for a variety of reasons that it would take me an hour to talk about. There are communities that are more adversely affected, including the Black and the Hispanic Latinx community, by COVID-19 in terms of morbidity as well as mortality. Now, in terms of MS patients being more vulnerable to coronavirus, from the research that we have, there is no data to suggest that just having MS puts you at increased risk to develop COVID-19. When we talk about outcomes, again, the things that we talked about on those slides that lead to poorer outcomes are if you have more high levels of disability, if you have more progressive disease, if you're older, and then if you have comorbidity. So many of the things that we see in the general population, in addition to a few things that we don't see in the general population. But just having MS doesn't necessarily put you at increased risk to contract COVID-19.
Okay, thank you. And the next question, Jill has already asked you. So we're either going to throw it back to Jill, or we may have a few more questions. I know we're nearing towards the end of our time together. So let's see.
Jennifer, I'm all set. So if you have more, please feel free.
Okay, so would like to know more about new MS treatments that do not destroy the immune system, which is a major concern in COVID-19 during the COVID-19 pandemic. Can you share anything about that, or if it is destroying the immune system?
Right. So again, so in a sense, the medications do affect or dampen the immune response. So we do have some treatments that actually do kill immune cells or destroy to a certain extent. But again, the medications that we use for MS do not affect the immune system to the same extent, let's say, as chemotherapy drugs, right? If someone has cancer and they receive some forms of chemotherapy, they may even have to stay in the hospital for a period of time because they're so at risk for infection. That is not the case necessarily with most of our MS drugs. As I said, the ones that we've seen that are associated with poorer outcomes are the ones that affect particularly B cells, rituximab and ocrelizumab, potentially, but certainly we have many other medications that affect the immune system in different ways that actually, several of them are actually being looked at as potential treatments for MS. So interferon is being looked at, as well as fingolimod as possible treatments for COVID-19.
Okay, so thank you so much, Dr. Williams.
Mitzi, we're out of time for questions, and we do want to thank Dr. Williams for being here and spending the time with us and educating all of you. Great, thank you. Round of applause. Yes, another again. Okay, next. Bill, my video producer, who's normally traveling around the country with me, providing these or recording and putting our programs onto our YouTube channel. Fortunately for MS Views and News, Bill has a production studio here about 20 minutes north of Orlando, Florida, and we've been doing like 90% of our programs from right here. And so it's been great, and that's why we're able to be socially distanced from everybody that's out there.